44% of Tennessee's private market runs through Blue Cross Blue Shield of Tennessee. Skip their prior authorization rules, and you risk delivering addiction treatment the payer never agreed to cover. 3 plan types, 3 different sets of review rules, and the provider manuals don't always make them clear. Here's what utilization reviews Blue Cross Blue Shield of Tennessee requires of addiction treatment providers, plan type by plan type. We'll cover commercial plans, TennCare and BlueCare Plus, and which levels of care need authorization under each. Prior authorizations, pre-certifications, certifications, utilization reviews, different names for one question. Will the payer cover this episode of treatment before it begins? These reviews ask the payer whether they'll cover an episode of addiction treatment at your facility before that treatment occurs. Concurrent and retrospective reviews happen during or after care. Today is about the reviews that come first. Deliver residential treatment without the required authorization on file, and there is no agreement that the payer will cover that episode of care. That's how authorization gaps turn into denials, appeals, and balances your facility ends up chasing. Behave Health's Revenue Cycle Management Service is designed to give hands-on attention to every component of your addiction treatment billing. We're not healthcare generalists. We only work for behavioral health providers like you. And the team has strong working relationships with every major insurance company in the United States. BCBST offers 3 basic plan types: commercial, Medicaid, and Medicare, and each has its own prior authorization rules. Let's take them one at a time. First, individual, commercial, and employer plans. Inpatient and residential detoxification, residential treatment, partial hospitalization, intensive outpatient, and applied behavioral analysis for substance use disorder all require prior authorization. Essentially, any addiction treatment that's not standard outpatient care requires prior authorization. And all out-of-network behavioral health care requires prior authorization regardless of level of care. For emergencies, BCBST's Utilization Management Team offers authorization 24 hours a day, and it can be done up to 2 days after care has begun. Second, TennCare, the Medicaid plan. TennCare's prior authorization list reads inpatient, substance use disorder, subacute hospital, and detox. But substance use disorder is a diagnosis, not a treatment. Does every level of care need authorization? The provider manual doesn't make it clear. Compared with the precise commercial terms, TennCare's list is vague, so confirm requirements with the plan before care begins. Third, BlueCare Plus, the least restrictive BCBST plan type for addiction treatment prior authorization. Only 2 levels of care require it: inpatient detox and residential substance use services. At the time of publication, partial hospitalization, intensive outpatient, and outpatient programs did not require prior authorization. Requirements are updated regularly, so verify current rules directly with BlueCare Plus. Side by side, the spread is wide. The same episode of care can need an authorization on one BCBST plan and none on another, which is why you check the patient's plan type, not just the payer's name. Behave Health's RCM service is designed to support every component of your addiction treatment billing. It starts with verification of benefits. Specialists manage utilization review, the authorizations this video covered, plus billing and collections and patient responsibility. And when a claim is denied, denials and appeals. Stop delivering care the payer never agreed to cover. Get behavioral health-only specialists on your BCBST utilization reviews. Book a 20-minute demo at behavehealth.com. See how it works. Book a 20-minute demo at behavehealth.com.